So what is the difference between normal aging joints and something that needs medical attention?
So I think that, as joints age, we know that the cartilage thins a little bit. There's a little bit of thinning of the cartilage can happen. There's also some wear and tear that happens. There are structures that exist within joints there's articular cartilage, which is the cartilage that covers the bone. Then there's a different type of cartilage, fibrocartilage, which is, for example, the meniscus in the knee, or a ring of cartilage around the hip called the labrum, which is also fibrocartilage, or the labrum in the shoulder. Those parts, the fibrocartilage, tend to get damaged. They can tend to get tearing, fraying, damage. And as we age, damage to the fibrocartilage can be around 30%, but as you get to 50, 60, 70, it can be as high as 50, 60, 70%. So those are kind of natural aging. Like I'm 52 years old. If you MRI my knee, I might have a little tiny meniscus damage, a little meniscus injury there. Where things get significant is when the joint has enough, you wear down enough articular cartilage, the cartilage that covers the bone, or you get significant damage to some of that meniscus or fibrocartilage, where it starts creating inflammation in the joint. You get little swelling, you get a little stiffness in the joint, you lose a little range of motion, and that can affect the way you move, the way you walk. It can affect the way you're able to play tennis with your arm. And when we start having pain or things that are not resolving with typical recovery, that's when we start saying, maybe you got to see somebody and take a look.
Kind of like my shoulder joints.
Exactly. Like all of us, right?